week.
All right. Okay. Welcome, everyone. And thank you for being here today for today's presentation on pacing for chronic pain. Um, I'm going to go a little bit over some of the things that Tiffany just mentioned. But yes, my name is Sarah. I'm an occupational therapist, and I work in Winnipeg, Manitoba. I've been in this field for about 7 years now, and working in chronic pain has been an interesting journey, that's for sure. The other thing I'll just mention is that in Manitoba we have something called the Manitoba Pain Care Program, which the government started within the past couple of years as an initiative to expand on pain care programming in Manitoba. So the pain care program is a multidisciplinary program that's offered at 5 different pain clinics across Manitoba. And our program offers a variety of services for patients living with chronic pain. I work at the Health Sciences Center branch of our pain clinic, which operates out of Health Sciences Center and is the largest of our pain clinics in Manitoba. At our clinic, we run a variety of workshops on different topics related to chronic pain. So I'm excited to be here today to share with you a workshop that I actually lead on a monthly basis at our pain clinic, which is on pacing for chronic pain. So that's kind of where all this information is coming from. I also have a little bit of a land acknowledgement that I'd like to go over, and just acknowledging that, we are gathering maybe from some different places today, but just acknowledging that everyone who's gathered here today lives, works, and meets and travels and lives on the traditional territories of Indigenous people of Canada. Myself and the clinic that I'm working at, we are located in Winnipeg, Manitoba, which is part of Treaty 1 territory. In addition to that, the other pain clinics that are in Manitoba are in at Pan Brandon, Selkirk, and Thompson, and we provide services across a variety of territories, including treaties 1, 2, and 5. And that we are able to offer our programs because we are able to use the original lands of First Nations, Inuit, and the national homeland of the Red River Métis Nation. So just acknowledging and respecting that First Nations treaties were made on these territories and that there have been many harms and mistakes, and that we as a clinic and as a program, we try to dedicate ourselves to collaborating in partnership with First Nations, Inuit, and Métis people in the spirit of reconciliation. A couple disclaimers I just have to go through because both my college and my manager want me to do that before I get started. So just a couple things I need to go over. The first one is that today's session is an information session. So it's not considered to be healthcare treatment, and I'm not able to provide healthcare treatment because I don't know you guys. So it's just general information on the topic. In addition, this session provides general information on pain management and on pacing so that you can take this information and determine if and how to apply it for yourself. Um, and this presentation does not replace the medical advice given by your healthcare team. So if your healthcare team has told you not to do some of the things I'm going to talk about today, please listen to your healthcare team. And then the last thing here is just that I'm not able to offer individual suggestions, advice, or recommendations in this session because that goes outside of my licensing. I can only do that when I'm seeing someone individually through my clinic. So if you are unsure of if or how these techniques or sessions apply to you, I encourage you to speak with your healthcare team about pacing and about some of these elements that we're going to talk about today if you're not quite sure how it might apply to you. All right. So now that I've gone through that, I'm just going to go through kind of what are we going to be talking about today. So our plan for today is to spend a brief amount of time going over some terminology. So I'm just going to start with some terminology, talking about pain, talking about energy and flare-ups and what those words mean as I go through today's session. Second, I'm going to spend a bit of time talking about some common activity patterns that people with persistent pain and low energy experience, and very common activity patterns that we tend to gravitate towards when we experience chronic pain. I'm going to talk about why we do that, how they influence our pain, and over time, what that kind of looks like for people. And then that's going to lead me into the last piece, which is where we're going to spend most of our time today talking about pacing strategies. So we're going to go into kind of what is pacing, how do we do it, what are the barriers that come up, and what are the tools that can help with pacing your activities. So that's the plan for today's session. So we'll start with some terminology. We'll start with pain. So when you live with chronic pain, it has a big impact on your energy levels. And this can make it even harder to do the activities that you want to do. So not only are you in pain, you're also exhausted. So pain and energy are very related, especially when it comes to pacing. We're going to talk about pacing both in terms of pain, but pacing can also be in terms of energy and the energy levels that you have, because sometimes that can be even more limiting for some people than the pain is. In terms of energy, when we talk about low energy, we're referring to, feeling like your battery is running low and like you're lacking the energy to do your daily activities. Terms like fatigue, being tired, low energy are often used interchangeably to describe this kind of sensation that of like when your battery is running low and you're lacking that energy to do things. And so throughout the presentation, I might use these terms interchangeably, and that's what I'm referring to when I'm talking about that. It's also important to note that you can have different types of fatigue. So there's like physical fatigue, mental fatigue, emotional fatigue, and all of these can impact our activities, and sometimes they can impact our activities differently. So when we're talking about pacing, we're going to be talking about pain and energy, and it's important to think about both of those kind of concepts when you're thinking about pacing for yourself, because they both can have an impact on what you're able to do and how you do it. And then the last kind of terminology I want to go over here is around flares. So when living with chronic pain or low energy, we often experience what people refer to as flares in their pain or flares in low energy. And when we talk about flares, we're talking about time-limited, significant increases in pain or fatigue that affects our function and limits us, whether that's for a few hours, a few days, or even a few weeks. So I'll often hear clients saying things like, I don't have enough energy to do what I enjoy. Or on a good day, I can get a lot done, and then I'm paying for it over the next few days and feel significant pain or fatigue. So if you catch yourself making these kind of comments, then this is the presentation for you. And that's what we're going to be going over today. So energy and pain are both very complex. And as a result, there are many different factors that impact both our energy levels and our pain levels because they are very complex things. The list that I have on the slide here is just, only a few of the factors that can impact things like our pain and energy levels, as we don't have enough time to go over every factor that can impact your pain and energy. Otherwise, we'd probably spend all day talking about it. But these are just some of the common things. So things like sleep, stress, activity, mood, and diet can all impact our pain and our energy levels. And so what we're going to be talking about today specifically is we're going to be talking about activity patterns, and we're going to be talking about how they can impact our pain and energy over time. But the reason I have all these other factors on the screen here is that it's important to kind of recognize that activity patterns are not the only thing that are going to impact your pain and your energy levels. And so, if things like your sleep or your stress or your mood or your diet, if those are things that you kind of recognize might be impacting your pain and your energy levels, then those might also be important aspects to start to look into for yourself to address to kind of help as well. But we're really going to be focusing today on activity patterns and how those can impact our pain and our energy levels. So, people who struggle with chronic pain or low energy levels tend to end up engaging in two different activity patterns, which are very common because they are just a very normal, natural response to pain and low energy. So I'm going to talk about both of those activity patterns today, and I'm going to talk about why we do them, but also how they impact us over time. So on the screen, you're able to see our first activity pattern we're talking about, which is called an underactivity pattern. So this graph is taken from Lorimer Moseley's book called Explain Pain. And Lorimer Moseley is a really great pain researcher from Australia. And so he has a book called Explain Pain that goes through a lot of kind of the science and understanding of what's going on when you live with chronic pain. So that's where this slide comes from. And on this slide, we have this graph for under activity patterns. So on this graph, we have the line going kind of up and down on the side that's labeled activity. And so this shows your level of activity. So if the line is near the bottom, then that's low activity. As it goes higher, then that's higher levels of activity. And then on the bottom, we have time. So we're looking at kind of over time, the levels of activity. So that's kind of the basis of the graph. The other thing you'll see on here is a dotted black line with the label of pain onset. So that line, when we're talking about the pain onset line, that's when you're doing an activity and you start to notice there's an increase or an increase of pain, or the pain starts depending on your pain experience. So that's what we're referring to as the pain onset. So looking at this graph, what you will see is you'll see that as you start to do more activity and you get closer and closer to that pain onset line, what happens is that this person will naturally kind of stop and rest before they get to that pain onset. And this can also, it could be resting, it could be stopping, it can also be avoiding activity because you'll get pain. And so you rest and then you do some activity and you rest and do some activity. But what you'll see here is that you're always staying kind of under that pain onset line. And when you do this, this can result in doing less and less over time because you're being underactive, you're avoiding activity. And what that leads to is that your pain or your fatigue onset actually starts earlier. So that black line, you'll see the dotted black line is going down as well. So as you do less, then the onset of pain and fatigue actually starts even earlier over time. So you end up in this like vicious pattern of doing less and doing less. And over time, it leads to a gradual decline in both activity and functioning, and often leads to people experiencing more pain and more fatigue for the same level of activity. So while it makes a lot of sense that, if you're in pain, you're going to do activity, and then before you get to kind of that pain onset, you're going to stop. What we actually have found through research is that this isn't a very helpful strategy because it leads to um, a decrease in activity over time. And again, it leads to uh, that pain onset starting earlier. So again, while it makes sense, it might not be very helpful in the long run, is what we found with this underactivity pattern. So that's the first pattern that we see people engaging in a lot. The second activity we often see people engaging in is what we call the overactivity pattern, or also referred to as the boom bust cycle. So the graph comes again from Explain Pain, same axes of activity and time. So let's say in this example, you're experiencing a pain-free day and you're trying to catch up on your activities or tasks like cleaning the house or cooking. But after doing a lot of activities in one day, you might experience a rise or an intensity in pain or tiredness. So when we look at this graph, you're having a good day, so you're doing more and doing more and doing more, and then you hit that kind of like pain onset line. And in this situation, what often happens is, well, that you just want to get it done. You don't want to stop. So you just keep going and you keep going and you do as much as you can and you persevere and you tolerate it as much as you can, trying to ignore the pain. Maybe you distract yourself. And then suddenly you get to the point where you can't handle it anymore. And that results in a crash. So you get to that flare up level and then you have a crash in activity. When you crash, then you have to stop activity to recover and rest. And then once you're feeling better, you may start doing activity again. And then maybe you start pushing yourself a bit too much and you do more than kind of your pain onset. And then you have another crash. So that's why we call it the boom bust, is right? Because there's a boom in activity where you're doing a lot. You get to that pain flare up and then you crash and you have to rest. And that can be for long periods of time. So this cycle kind of tends to repeat itself over and over again, which often results in like feelings of frustration and anger and just wanting to get the activities and the things done that you want to get done. So again, this is the boom bust cycle because there's periods of boom followed by periods of bust in activity. And over time, again, what we see is that your activity levels gradually decrease because managing activity levels like this is not sustainable in the long term. So, similar to the underactivity pattern, over time, you end up with a gradual decline in activity and end up experiencing more pain and fatigue with less activity. So, I would just encourage you, kind of after going through these two slides, just thinking for yourself, um, you know, do either of these activity patterns resonate with you? Do you notice that you do one or the other? Or maybe you notice that you do both? And just thinking for yourself, how has this served you over time? Has this been a helpful strategy, or has it been really difficult to manage the things that you want to do with engaging in one of these patterns of activity? Something to think about. Um, so, what we found kind of through research and what I find working with my patients is that when people are engaging in the kind of underactivity pattern or the overactivity pattern, they often find that they're not very helpful and that they're not able to kind of manage or do the things that they want to be able to do. And they often end up with pain, kind of regardless of whether they're being under or overactive. So, since neither of these activity patterns are necessarily helpful with chronic pain, it kind of begs the question, is there another activity pattern that is more helpful for someone when you're living with chronic pain? And well, there is, and it's called pacing, and that's what we're here to talk about today. So, um, I'm going to get a bit into pacing in a little bit, but just understanding or kind of mentioning now that with pacing, we're not being overactive and we're not being underactive, but we're trying to find that place right in the middle where we are getting the right amount of activity. So this is difficult and it's not typically a natural response to pain. So it does take some learning and some tools and some figuring out how exactly to do it. But over time, by approaching activity this way, what we found through research is that you actually can start to become better at pacing yourself. And over time, as you pace yourself, people find they're able to do more activity over time. Whereas with the other two activity patterns, what we find is that people are doing less over time. So we're going to get into how exactly you do pace, but first, I'm just going to kind of take a second to talk about uh, why changing activity patterns can be helpful. So a couple of things. So the first being, learning to change our activity patterns is helpful because it can help to reduce the amount of pain flares we have. And if we aren't having pain flares, then we don't have those periods of needing to rest for a really long time that can really be difficult for us. In addition, we can help to reduce the amount of fatigue that comes with activities when we are pacing our activities. It allows us to do what is important to us. It allows us to be in tune with our bodies better. And then by using energy management strategies, we don't have the same decline in activity over time. And we can actually start to increase the amount of activity we're able to do gradually over time without making the pain worse. So pacing. We're going to talk about several things today with pacing. So first, we're going to talk about pacing and talking about kind of what it is, how do you do it? Within that, talking about breaks, breaking up activity, grading activity as three different kind of ways of pacing yourself. Then we're going to talk about some barriers to pacing because pacing is, like I said, it's not kind of the natural way we tend to do things. So that can make it a little difficult. And then I'm going to finish off by going over some different tools and strategies that can be really helpful in being able to pace ourselves. And specifically, I'm going to go over things around planning, prioritizing, and goal setting that can be helpful when it comes to pacing. All right. So pacing is about a lot of different things. And so with pacing, what exactly is it? So, pacing is learning to maintain a level of activity that's tolerated both by your body and your nervous system without doing too much or too little. How exactly do you do that? Well, we're going to talk about that, but it really comes down to alternating our activity and rest intentionally. And I have intentionally kind of all caps because it really does have to be intentional. This is not just like a natural thing that we tend to do. You have to be very intentional to be able to figure out how to pace your activity. And then kind of once you're able to alternate your activity intentionally, then pacing starts to look at how you can slowly start to increase the amount of activity over time so that you're able to do more. There are a couple different ways to alternate activity to pace yourself. So it's important to note that you cannot just pace. You have to kind of start to trial different things to see how it goes, figure out your tolerance for activity, what your body and your nervous system can handle. And then you have to start to be intentional about implementing strategies to ensure that you are pacing yourself. So it does take some work. Um, so the first pacing strategy we're going to talk about is taking planned breaks. Having planned breaks helps our bodies to rest before it's too late, and we experience an increase in pain or fatigue. But we can't rest too much. So it's about finding the right balance for ourselves and finding the right level of challenge for our bodies and for our nervous system. So the key is to take planned breaks before you have an increase in pain or before you're exhausted, and to take a break that's restorative to us. So that can be difficult. So on this slide, I'm going to go over some strategies for how to take breaks before the pain increases. And then I'm also going to talk about kind of what it means, what a restorative break means. So the first thing I'm going to talk about here with break strategies is timing an activity. So one of the things that can be helpful when it comes to pacing yourself is timing. So before starting an activity, you can set a timer for how long you will be doing it before you stop and take a break. So like actively setting and using a timer on your phone is one of the best strategies for planning breaks to be able to pace yourself. So if you have a hard time stopping an activity, I even find sometimes for my patients, what I recommend is them setting two timers. So for a lot of my patients, what they'll do is they'll set a timer. So say they're planning on doing the activity for 15 minutes. They might set a timer for 10 minutes and 15 minutes so that they have a warning to wrap up, because a lot of what my patients find is that once they get into an activity, they don't want to stop. So having some kind of a warning and letting you know that you need to stop soon is actually really helpful. So having kind of two alarms set, one as kind of as a warning, and one is a final reminder that you do need to stop now. So timing your activity can be a really great way to make sure that you are taking breaks as you need it. And then over time, we're going to talk soon about kind of increasing activity. But one of the great things with timing activity is that it helps you to then, you can start to maybe instead of 15 minutes, you go up to 16 and then 17. So timing is a really great way to then be able to increase over time as well. The next strategy I have here is alternating timers. So similar to timing activity, you're going to be using some kind of a timer. But instead of just setting an activity time, doing it and resting, what we're doing here is we're doing alternating. So you're alternating rest and work. So an example would be maybe you want to clean the kitchen. So instead of just cleaning the kitchen and then crashing afterwards because you cleaned the kitchen for too long, we could do some alternating timers. And you could alternate maybe 5 minutes of cleaning with 10 minutes of some kind of a break. So maybe for you, it would be watching TV. We're going to talk about breaks in a second, but alternating 5 minutes of cleaning, 10 minutes of watching TV, and then 5 minutes of cleaning, 10 minutes of watching TV, and then you go back and forth until you're done the task that you want to do, which is cleaning the kitchen. So just setting timers for each activity, and when you switch between activities, turning the timer on again as a way of pacing your activity and keeping yourself from spending too much time cleaning the kitchen. The next strategy I have here is alternating tasks, and that is very similar to alternating timers, but instead of alternating with an activity and a rest, alternating tasks is alternating two styles of activity. So you might find that, you have two things you want to get done. Maybe you need to do You need to clean the living room, and then you need to make your meal plan for the week and your grocery list. Well, instead of doing one and then the other, then maybe you're alternating between the two. So maybe you'll do 10 minutes of cleaning, then 10 minutes of meal planning, and going back and forth so that you're still being productive if you're feeling like you need to get these tasks done, but you're alternating them so that you're not exhausting yourself with one or the other to the point where you need to kind of rest and take a break. So you can alternate the different types of tasks that you're doing. If you, but again, that's really individual and depending on the kind of pain that's going on for you and the kind of exhaustion or fatigue that you might be experiencing. You need to kind of figure out and to try some of these strategies to figure out what works for you. The next strategy I have is scheduling breaks. So if you know you have a certain activity that you need or want to do, then planning a break before or after the activity can be really helpful. So for example, if you're going to coffee with a friend, then resting for 30 minutes before you go to coffee and planning 30 minutes for rest when you get home can be really helpful. And you have to like schedule and put that into your calendar so that you're intentional with that rest so that when you get home, you don't maybe start doing something and overdo it for yourself. So when you know there are bigger things going on in your schedule, you can intentionally schedule breaks around it. And related to that, one of the things I find helpful if you're in a work setting is if you have the flexibility within your schedule, you can also schedule breaks within your schedule. So thinking about when you're doing certain things and making sure that you're scheduling time in between, if that's something that you need. And then the last strategy is breaking up activities, which is kind of a bigger strategy. So I have a whole slide on it next. So I'm not going to touch on that, but we're going to talk about it next. And then the other piece I mentioned is that it's important when you're taking breaks for the breaks to be restful or restorative. So sometimes we tend to engage in activities that are not as restful, or we get distracted and start doing another activity right away. And then we're not actually getting the break or the rest that we need in between activities. So it's really helpful to actually spend some time and jot down for yourself and think about like what are some actually kind of restorative breaks for yourself and what is something that's actually restorative. So I know for myself, for example, when I have breaks, I tend to immediately kind of pull up my phone and go on social media. But that's actually something where after spending 5 minutes on social media, I don't feel more rested or recovered. I probably feel worse. So that's something I'm trying to do less of because it's actually not a very good break for me and it's not very restorative. So it is helpful to think for yourself what is kind of a restorative break for you. Some examples we have here, and again, this is, selective and individual, and you have to figure out what works for you, but some things that could potentially be restorative breaks could be things like doing some relaxation, doing some gentle stretching. It could be practicing some deep breathing. For some people, it might be reading. Again, that depends on you and whether you like to read or not, or watching TV, or maybe it's something like calling your friend. But it can be really helpful to just spend some time and actually think for yourself, like what is actually a restorative break for me? And make a list of those things for yourself so that when you are taking these breaks, that you're intentionally doing something that's actually restoring you. Okay. So the next thing here around pacing is, like I said, breaking up activities. So this is another strategy. I just needed a slide to kind of go through all the details that come with breaking up an activity. So an important way to take breaks and pace yourself is through breaking up your activities and thinking about how exactly the activity needs to be done. We often do tasks and activities a certain way because that is how we learned how to do them, but we really don't have to do it that way. So for example, let's think about someone who maybe wants to make a curry for dinner. So this person, she says she can't do it because her back pain and her leg pain prevent her from being able to stand for more than 5 minutes. So it is possible that this person can make their curry, but they're probably going to have to do it differently than how they normally do it. When someone typically makes a curry, it usually involves standing and cooking in the kitchen for like an hour, and clearly this person cannot do that. That would cause them a lot of pain and aggravation if they just tried to keep pushing through. So we might want to think about things like how do we break up the task? How do we make it more realistic? How do we simplify the steps? And can we alternate positions? So these are all different ways that we can break up or change the activity. So with this person, they said that they can kind of stand for 5 minutes before they need to rest with their pain. So 5 minutes is kind of the limit that we're looking for. And then kind of asking that person, like, how long do you need to really like sit before you're feeling rested, before you can get up and start kind of standing and doing things again? And they said 5 minutes. So again, this is going to be different for everyone, but this for this person, they said 5 minutes of sitting, 5 minutes of standing. So as we break down this task, we can think about kind of making a curry. What are some of the tasks? Well, we need to cut up the onions. We need to fry the onions. We need to measure spices. We need to saute the spices, chop the veggies, saute the veggies, and then simmer everything together. So those are the steps. So we can think about how can we do this differently? Well, maybe we can do some of the activities sitting down. So things like cutting the onions, measuring the spices, chopping the veggies, like those could all be tasks that are sitting. And then some of them you do have to be standing. So things where you're like at the stove, like frying the onions, you're going to need to be standing. So you can start to alternate. You might do kind of 5 minutes of cutting, and then you go to the oven and you cook the onions for 5 minutes. Then you sit down and you measure out your spices and figure everything out for 5 minutes, and then you stand and you saute things for another 5 minutes. So thinking about how you can alternate positions there, right? Like we're alternating, we're breaking up the task by alternating sitting and standing. We're also maybe going to simplify some steps. So maybe you can buy pre-cut frozen onions and use those instead. Maybe you can buy your naan bread from the store so you don't have to make the naan bread. But thinking about how can you break up the task? How can you simplify the task? And how can you alternate positions while you're doing the task so that you're doing it differently than you normally would, but you're still able to have the same outcome, which is being able to make dinner and being able to eat it, even though it's maybe not the way that you typically would do it. So those are just some of the ways that you can break up your activities to help pace yourself some more. So that's something a skill that can be really helpful with a lot of like household activities is starting to think about how you can break them up and maybe do them differently than you normally would. Okay. And then the last piece of pacing that I'm going to talk about is grading your activity. So with grading your activity, that kind of comes back to the activity patterns we were talking about before. So we discussed that both underdoing and overdoing activity patterns results in a decreased activity level over time. So that brings back up the question of how do we increase activity levels safely so that we can do more? And that comes down to this idea of grading our activity or grading our activity levels. So when we're grading our activity levels, what we're doing is we are kind of taking the way that we pace an activity, and then we're slowly starting to increase it over time so that we can do more. So how do you do that? There's a couple steps. The first is to establish your baseline. So your baseline is where you're going to start with your pacing. And that's your starting step. How do you find your baseline? Well, the first thing you have to do is you have to find your tolerance. So your tolerance is how long can you go before you get to that pain threshold that stops you. And so maybe you're able to, we'll say walk. So maybe you're able to walk for 10 minutes. And once you get to that 10 minutes, that's when the pain really starts. So we don't want to go right to that 10 minutes because that's not going to be very helpful, but maybe we'll choose a baseline that's just under that. So we'll choose a baseline of 8 minutes. So you can do 8 minutes safely and it feels okay. So then that's where we're going to start with our baseline is 8 minutes because that feels okay with your body and that feels okay with your nervous system. So once we choose that baseline, then we're going to do that activity at our baseline for several times. And then we're going to start to slowly increase it. So maybe you'll do kind of for 1 week, you'll do like 3 walks for 8 minutes. That goes really well. Well, then next week, we're going to try 10 minutes. And then we'll do that for a week. And then maybe the week after, we'll try 12 minutes. But it's about starting at that baseline and just increasing little by little over time, only changing one factor and slowly increasing that activity to be able to do more activity, but we have to make sure that it feels safe for our bodies and for our nervous system. So it is a very slow process. And so slowly what you'll find is that over time you're able to do a little bit more and a little bit more activity. One of the things I have here is this is basically a worksheet on how to do graded activity. It comes from the UK National Health Service, and I have the link here, so I'm going to try if I can find the chat. I'm going to throw it in the chat so that if people are interested in this type of a worksheet, you can just go to that reference and you can download the worksheet. But basically, this goes over what is graded activity, how do you do it, and it helps to walk you through making your own activity plan. So if this is something you're interested in doing, this is an option that can be helpful for you. All right. So pacing in and of itself kind of seems like a simple concept, but can be difficult to implement in our lives as there are a lot of things that can complicate it and get in the way. So, an important part of pacing is to actually anticipate potential obstacles and how you're going to manage them. And so, when kind of after you've come up with your pacing plan, I often encourage people to just sit down and think for yourself, what are the barriers that might come up for me, and how am I going to deal with them when they do come up? So, that can also be an important piece here. But I'm just going to spend a couple minutes just going over some of the kind of potential barriers that come up for people, and just kind of noting some of the really common things that we hear from people. So the first one is habits. So changing a habit can be hard. We often fall into a routine with our behaviors. So it's important to be aware of your habits and try to incorporate pacing as a habit. Being intentional, making it kind of a regular part of your day are some of the ways that it can be most helpful to start developing it as a habit, actually putting it in your schedule. Expectations can be a really big barrier. You might have expectations about what a task looks like or how it should be done. And so it can be really helpful to think about how you can modify and break up an activity so that it works for you and your pacing plan. And just remember that, like, just because you do something a certain way doesn't mean it has to be done that way. Like, just because this is how you were taught how to do laundry doesn't mean that's how you have to do laundry. There's no one right way of doing laundry. Comparisons can be a huge barrier for a lot of people. So comparing yourself to what others are doing, or more often comparing yourself to what you used to be able to do, can really make it hard to stop, which leads people to then overdoing activities. So it's really important to just remember that you are doing your best and to just notice when you are being hard on yourself, because that can actually make things worse for yourself. And so trying not to compare yourself, just doing and paying attention to what you can right now. Asking for help, this is difficult. So the stats show us that people with chronic pain tend to be helpers and they don't like to ask for help. But asking for help can actually be really helpful when you're working on an activity or a goal and can lead to you being more successful with that goal. So asking for help can be a really big kind of help when you're working on pacing. Feelings, so things like frustration, anger, guilt, commonly are emotions that come up with chronic pain can really pull us and get us off course with what we're working on. So if you notice that your emotions tend to take you off course and get you overdoing things, it might be worth looking into some kind of strategies for dealing with the emotions that might be getting in the way. Good days. So good days may not seem like an obstacle, but if you're having a good day, it can really be hard to stop. But just continuing, writing out your plan and sticking to it, even on the good days when you feel like you could do more, is an important piece with pacing. And busy days. So when things get busy, we don't pace ourselves. So it is important to plan ahead and space out our activities and our commitments. All right, and I'm running out of time, so I'm gonna kind of try and get through the rest really quickly. But now I'm just gonna move on to kind of 3 tools that can be really helpful for pacing. So the first one is planning. So if you are wanting to kind of pace yourself, the most important thing you really can do is just like sit down and write out a plan for yourself. So write out that plan, think about it, post it for yourself somewhere so that you can see it and you can review it. Plan the time of day. So thinking about when, maybe when is the best time to work on this pacing activity or goal that you have. So if you have more time, more energy in the morning, so then maybe you do some of your meal planning or prep in the mornings, so that you are kind of using your energy when you have it. Making it a part of your routine. So making it a part of maybe your daily routine or your weekly routine, but putting it in somewhere in your schedule that works well for you. Um, Gather the items. So plan ahead, think about what you need so that you're successful with your goal. Use a calendar or some kind of device so that you know when you need to do the different aspects of your pacing that we're talking about. And then track your progress. So document how your tasks are going, and what is working well and what is not working well, and just thinking about how you can manage the barriers that are coming up. As you track things, you'll be able to make more progress that way. If you just kind of do things and you don't pay attention to how they're going, it's not going to be as helpful for you. The next tool that can be helpful is prioritizing. So, learning to prioritize tasks can be really helpful if you're an overdoer. So, this is called an Eisenhower's matrix, and basically, it's a tool to help you with prioritizing your activities. So, it can be really helpful to write down your activities you need to do in a week, and then go through this matrix and figure out what's important. So, we have the do categories. So, those are activities that are urgent and important. We have decide. So those are activities that are not urgent but they are important to you. We have delegate. So, oops, I don't know if I changed slides on you, but there we go, we're back. Delegate is things that are urgent but not important. And then delete is tasks that are just not urgent or important. So I'm going to kind of quickly go through an example. So let's say that you're a grandparent and you have plans for this Saturday to clean your garage, to attend your grandson's hockey game, and then you also want to host dinner for your kids afterwards. If you're going to be pacing yourself, you might kind of plan ahead of time and prioritize your activities and realize that's too much to do for you in that day. So thinking about these activities and going through the matrix, we might say, okay, what's important to me? Well, we'll go through the first thing is cleaning the garage. Is that important to me? Yes. Is it urgent? No. I could do it at any point in time. So that goes into the decide category. And I'm going to decide to do it next weekend because I don't have anything else going on next weekend. I want to go to my grandson's hockey game. Is that important to me? Yes, because family is very important to me. Is it urgent? Yes, because it's only on Saturday. So that might lead it to being in the do category, and I'm going to do that activity. And then the last thing is that I want to host my family for dinner. Well, is that important to me? Hosting dinner isn't important to me. What's important is spending time with my family. Is it urgent? Well, I'd like to do it after the game. So I might put that into the delegate category. Maybe I can ask my son to make dinner for everyone so we can spend time together. Or maybe I could suggest we all go out for dinner so that we can spend time together. So I'm going to delegate it or do it differently. So it's not taking up as much of my pain tolerance and my energy, but I'm still getting out of it what I value. So that's just a quick example of how you could use a tool like this. It can be really helpful to use this type of a tool. I have another kind of worksheet here for you guys for the task matrix that I'll put in the chat. But basically, what you do to use this is you write down your tasks for the day or the week, and then you go through the categories and you put them into the different quadrants depending on whether they are important or urgent to you. And it can really help to kind of filter and sort what is actually important for you to do that week. Okay. And now I think I'm a little bit over time, but I'm just going to go into my last tool here, which is goal setting. So goal setting can be so helpful when it comes to pacing because unless we have clear goals, then sometimes it can be really hard to achieve them. So when it comes to the goals and goal setting, it's helpful to kind of make it a SMART goal. So I'm going to go for an example of maybe my goal is that I want to clean the kitchen and I want to clean the kitchen more. Is that a SMART goal? Not really. It's very vague. Clean the kitchen more. What does that even mean? So maybe I'm going to try and make that a SMART goal so that it's more achievable and helpful for me when it comes to my pacing plan. So the S In SMART goal, it stands for specific. So what do we specifically want to achieve? So in my cleaning example, maybe we could say what I want to achieve is that I want to clean a section of the kitchen for 15 minutes each day. So that's specific, right? The M stands for measurable. So how do we know when we've achieved a goal? So for example, a goal of cleaning more is not easy to measure. However, a goal of cleaning the kitchen for 15 minutes a day is more easily measurable. It's something we can check off on the calendar as it's completed each day. The A stands for attainable or achievable, sometimes people use. So in the case of cleaning, let's say you can easily clean the kitchen for 15 minutes on any given day without your symptoms increasing. If that's the case, then yes, it is achievable or attainable. If not, then you might need to alter that. The R stands for relevant, sometimes also realistic is what they refer to it as. So in this goal, relevant to you is, is this something that is important or motivating? So is cleaning the kitchen important? If yes, then that's relevant. The other part to consider is if it's realistic. So let's just think about, cleaning the kitchen for 15 minutes every day. Is that realistic? It might not be. Sometimes other things might get in the way, like an unexpected visitor or a trip to the grocery store. So maybe we can modify our goal to be, cleaning the kitchen 15 minutes for at least 3 days in a week. That's more realistic to be able to do it 3 times in a week. And then the last thing is T, which stands for time bound. So when do we want to achieve this goal by? So if we look at our cleaning goal, maybe we could say that kind of within the next month, we would like to work up to cleaning 15 minutes 3 times a week. And that gives us a goal so that in 30 days we can evaluate whether or not we've achieved that goal. So once we've gone through the SMART protocol, we've gone from a goal of I would like to clean my kitchen more to, by in 30 days, I will clean an area of my kitchen for 15 minutes a day, 3 times a week. And then I will place a check mark on my calendar when the task is complete. So that makes the goal a lot smarter and a lot easier to determine whether or not it's been achieved. So I have one more worksheet that I'll put in the chat, but this is just a worksheet that comes from the Lake Superior University on how to set SMART goals. And it basically just walks you through exactly that, which is how do you kind of write out a SMART goal, and it works you through each step so you can write it out for yourself and come up with your own SMART goals. All right, so there we go. So the take-home messages here are that activity patterns can impact your pain and energy. Doing too much or too little can actually limit you. Pacing can be a very helpful way to change our activity levels. There's many things that can get in the way of pacing, so managing barriers is an important thing to pay attention to. And that things like planning, prioritizing, and goal setting can actually really help you to be able to pace yourself in the long run. So from here, some things you can do would be to download the worksheets that I mentioned, maybe schedule a time to sit down and write out a plan for yourself. You can go through and complete the worksheets, share your plan with others, notice barriers that come up as you work on your plan and address them. And when you have setbacks, keep going. So I know I went a little bit over, so I'm sorry about that, but thank you everyone for attending. And I'm happy to answer some questions. But thank you also to Tiffany and to the Occupational Health Center for having me today.
Thank you, Sara. This is really, really great information. You put it up. We learn a lot from you. That's really, really informative. You sharing your worksheet, everything. Yeah, that is very, very beneficial for all of us. Now I'm going to stop the recording. Then we'll lead to the Q&A session.